anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic. Let's look at Ebola. I'm sure all of you read about it in the newspaper. And as you look at what went on, the problem wasn't that there was a system that didn't work well enough. The problem was that we didn't have a system at all. In fact, there are some pretty obvious key missing pieces. We didn't have a group of epidemiologists ready to go who would have gone, seen what the disease was, see how far it had spread. The case reports came in on paper. It was very delayed before they were put online, and they were extremely inaccurate. We didn't have a medical team ready to go. We didn't have a way of preparing people. There was no one there to look at treatment approaches, no one to look at the diagnostics, no one to figure out what tools should be used. As an example, we could have taken the blood of survivors, processed it, and put that plasma back in people to protect them. But that was never tried. So there was a lot that was missing, and these things are really a global failure. The WHO is funded to monitor epidemics, but not to do these things I talked about. You can have a virus where people feel well enough while they're infectious that they get on a plane or they go to a market. What are the key pieces? First is we need strong health systems in poor countries. That's where mothers can give birth safely, kids can get all their vaccines, but also where we'll see the outbreak very early on. We need a medical reserve corps, lots of people who have got the training and background who are ready to go with the expertise. And then we need to pair those medical people with the military, taking advantage of the military's ability to move fast, do logistics, and secure areas. We need to do simulations, germ games, not war games, so that we see where the holes are. Finally, we need lots of advanced R&D in areas of vaccines and diagnostics. Now, I don't have an exact budget for what this would cost, but I'm quite sure it's very modest compared to the potential harm. The World Bank estimates that if we have a worldwide flu epidemic, global wealth will go down by over $3 trillion, and we'd have millions and millions of deaths.